Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by Ignite DDS Coaching, empowering dentists to build self-determined futures. Together, we're shaping the next generation of leaders in dentistry. In this episode of Dental Fuel, we have Doc and Dawn Ifedi, a super passionate and dynamic duo who are here to share some insights and some mistakes. In this first episode, Doc and Dawn talk about some clinical mistakes that they have made and how they handled them. Let's listen in. Doc and Dawn Ifedi, welcome to Dental Fuel. How are you doing today?
Doing great.
Doing great. Thank you for having us. We're excited for this crossover episode. So it's going to be a fun one.
Yeah, I'm excited for this crossover episode, and I'm excited to learn more about you all and what you all do in your world of dentistry. And so before we get into it, I would love if you would let our listeners know a little bit about yourself.
All right, so I will start. So my name is Dawn Ifedi. I'm a registered dental hygienist as well as the office manager of Empire Dental Group, as well as the Rich Life coach for the Generational Dental Wealth group, amongst many other things. So I am, to start, well, the registered dental hygienist at Empire Dental Group. So I, as well as Dr. Ifedi, one of the two practitioners there. So we see the patients every day. We do all things practice management. We work with other doctors when it comes to building their rich life, what that looks like for them, and how to take their life that they currently live and maximize it to the biggest and the best potential.
Sounds good.
Very cool. You wear a lot of hats. It sounds like maybe you're working harder than Doc is. But Doc, tell us a little bit about yourself.
She forgot the most important job. She's my wife.
But, yes.
Oh, that's right. That's right. There you go. Oh, that's very nice.
The name was a giveaway. No, that's not.
So for myself, my name is Dr. Jermaine Ifedi. Originally from Nigeria, born and raised in Charlotte, North Carolina. I went to East Carolina for undergrad and graduate school. I got my master's of business administration from there. Then I went on to UNC Chapel Hill and got my DDS. That's why I became a dentist. So since then, since graduation, I was a traveling dentist. Worked in almost 90 different cities. So that was a good time with a specialized care for geriatric patients. That was my love and passion. Still is my love and passion. With the average age of our patient base being around 40 to 50 years old, we don't see many kids, but we see a lot of grandparents and great grandparents, which is always fun for us. So for myself personally, passionate about dentistry, passionate about finances. Um, I would say my first love was understanding finances, getting my MBA first. So it was actually kind of difficult going from the MBA program to dental school because the MBA program was all collaborative, case studies, groups coming together, figuring out how can we solve these different challenges and maximize businesses. Then when I came to dental school, it was a shocker. I thought we were going to come in, we're going to collaborate, we're going to figure this thing out. I quickly found out that, you know what, this is a race you might have to run with a little bit less people, you know. But as you continue to go on, glad I never lost that because as I entered the field of dentistry, that collaborative spirit came back and it grew and it's been fostered. And that's one of the reasons that really motivated us to be able to create the Generational Dental Wealth platform and the Dr. Wealth group because now we get to be able to talk to so many different doctors, lead so many different groups, and be able to help people figure out how do you maximize and live your personal rich life. Tell us something about you, Dr. Tanya.
Well, thank you for the question. And Doc, you know what? Before I get into talking a little bit about myself, I'll tell you what, I'm not the numbers girl. So I'm excited to learn a little bit about what you all are doing and helping dentists out. But, you know, I was excited when I got into dental school and only had to count up to 32. So just a little bit of a difference there. But I'm Tanya. I work in public health. And I just have a kind of a commitment to serving the underserved. And I also am a part-time faculty member at a dental school here in El Paso, Texas. And I'm excited to be hosting Dental Fuel. I do this for Ignite DDS. And I get to meet so many wonderful people like yourselves and kind of hear different dentist stories and dental professional stories and, you know, their walks of life and all the awesome things that they're doing. And I learn, and hopefully our listeners learn so much from everyone who we've interviewed. And so it's been very rewarding to have this opportunity to do this.
That's amazing.
But
I did want to give a shout out to Dr. David Bryce. We invited him to come speak at our national conference probably about 4 or 5 years ago, and that's the first time I met him. He graciously accepted the invitation, came out and gave so much great information and so much great energy. So this is a full circle moment. We actually interviewed him on our podcast before, and for some odd reason, the episode got deleted. So we're gonna have to
Oh,
run that episode back. But
we've all been there.
yeah, don't you hate that, right?
Yeah, we've all been
That
there.
was a great episode too, man. Oh man. So it's a full circle moment. So I'm glad that this
Oh, that's
relationship
wonderful.
has continued to
Yes.
grow and thrive for sure.
Yes, David is just such a great supporter of young dentists and even seasoned dentists, but he really just tries to help where he can, and he's an excellent speaker as well too. So if any of our listeners are looking to plan a meeting, definitely reach out to him because he's a great supporter
And he'll come.
of all things dentistry, and he'll
Some
come.
people are
That's
great,
right.
but they
That's
don't
right.
come. He'll come.
That's right. That's right. Well, here at Dental Fuel, we're dedicated to learning from each other's mistakes and growing from those mistakes. And sometimes we say that, mistakes really aren't mistakes, but they're just kind of learning opportunities that we learn along the way of life. And so, don't think mistakes are too scary, but it's a great opportunity to learn from each other. But I would love to know a little bit about a clinical mistake that maybe you all have made in your journey so far and how you decided to handle that.
I would probably say, personally, my one of the biggest clinical mistakes I had wasn't really necessarily clinically based, but it was the patient management aspect, which is probably one of the biggest aspects when it comes to clinical dentistry. You're not just treating teeth; you're treating a person that moves around and lives an entire life. So dealing with this particular patient was not necessarily understanding that this is just one of those patients who just were not going to solve their problem. It doesn't matter what you do. It doesn't matter what answer you give. There's just certain patients that unfortunately you're just not the best dentist for them. It doesn't make them a bad patient. It doesn't make you a bad clinician. It's just sometimes you can't serve everybody. And I think if I would have identified that earlier in our relationship, it would have left a lot less strain. All practicing dentists have seen or thought to themselves one time when you see a certain patient on your schedule, it's just like, oh, not again. Honestly, though, but I mean, life is so short. We shouldn't even have to really sit through those kind of tough situations like that because patients feel that, right? And they deserve to be in the best place for them where somebody's excited to see them every single day, right? So if I would have identified that earlier to say this relationship wouldn't have worked out, I would have been able to, say it might be best if we get you referred out somewhere, or I can get you to another colleague that is better suited to be able to help you get to where you need to be. I think one of the biggest things that conflict that we did have was a generational difference, and there was no way he wanted it bridged. It was just something that he was okay with. So I'm used to it with the passion for geriatrics. I'm used to seeing all different kind of generations. But this particular bridge was just one that just could not be crossed. So by the time the relationship finally did end, he was very vocal about it. He wanted to leave reviews about it, and he wanted to make
Ooh.
a bang on his way out, right?
Yeah,
But again,
for
you can't
sure.
really help it, right? So through two plus 2.5 years of my
Yeah,
practice at that point,
yeah.
all 5 star, and he was the first one star. So no matter how much you give, right? No matter
Hmm.
how hard you go,
You can't
sometimes
satisfy
you
everyone.
can't satisfy everybody. It's out of your
That's
control.
right.
So that's just something I had to internalize. So instead of thinking to myself, "Oh my gosh, you got a 1 star review,"
Yeah,
I thought to myself, "Oh my gosh, you have 200 5 stars."
yeah.
Right? How do you stay positive and keep
Hmm.
reminding yourself that you know what you bring something great to the table, right? And unfortunately, not everybody's is that's going to be their flavor, right? But
Hmm.
that's
Hmm.
definitely what I took away from the situation.
I think that's
Yeah, I'll
that's
tell
really
you
good.
what, before I went to dental school, and when I always thought I would become a dentist, I thought everyone was going to love me. That would have a great time, and I'd build rapport with everyone, and it would just be all rainbows and butterflies. But that truly is not the reality of the profession.
Yeah,
And so I think that it's so important to have these conversations and to learn to kind of build past it and look at the positive. And for one bad review, you have so many other positive ones, and the same thing, you have so many other positive relationships in your practice.
for sure.
But what about you, John? Any clinical mistakes on your end?
I would say kind of similar to Dr. Teddy, but more so like case selection. So when it comes to patients, which cases are the best to take on, which ones make the most sense. So when it comes to certain patients, especially if you are starting a new practice or taking over a previous practice, you want to make sure if there's a smooth transition when it comes to patients. So when it came to this particular patient, it was more so. that he was teetering on that line of needing to see a specialist, but
Mm-hmm.
we could, if he was able to maintain in the practice, because as we all know, sometimes if a patient has periodontal disease, they can be referred out and they can stay, or they can be referred out and come back to general practice.
Mm-hmm.
So for his case, he could have been referred out and come back, but he was a previous patient, so we wanted to see what we could do for him at the practice first to make sure that we got him in the best hands if need be, or if we were able to kind of manage and maintenance things in office and he was able to maintain things at home. So, but we gave him the entire spiel of everything. We let him know his current condition with updated x-rays, everything. And when it came to the point where we needed to refer him out after going over everything with him, I think he came into probably the practice twice for perio maintenances. He just refused to understand what the next steps were supposed to be for his current condition.
Mm-hmm.
So when it came to that, there was a bit of a misunderstanding on, or refusal more so of understanding on his part. I don't even want to say misunderstanding because we tried the best to our ability to explain to him what his condition was, what we need to do, what next steps. But what one thing about dentistry and a lot of patients that they don't necessarily understand the referral process like they do in the medical field. In the medical
Mm-hmm.
field, it seems like they have more of a clear understanding of, okay, you need to go see a specialist because of this. This is a primary care provider office, and we need to get you
Mm-hmm.
to this orthopedic doctor or this ear, nose, and throat doctor, or anything like that. But when it
Mm-hmm.
comes to dentistry, although general dentists, general practices can do a lot in house, and generally we do a lot in house. Once it gets to that point, a lot of patients just see as me going to a specialist is more dollar signs, and that's not always the case. It's more so you have a
Mm-hmm.
specialized case. Let's get you to this specialist to make sure it's taken care of properly. So when it came to this specific patient, he just wanted to do a lot of back and forth, and I'm sure we've had a lot of patients like that where they don't understand it. They just think that it's a money grab or
Mm-hmm.
that we're just doing something special or something new in dentistry, and it's not the case. We just want to make sure that we get you to the best hands.
Case selection is huge, but also doing the right thing for our patients and trying to guide them, I think, is so important. And I completely understand. I think that there is a lot of misunderstanding and lack of knowledge from the patient part as far as how referrals work and why they have to go and see different specialists. But I think that the a parallel is there with medicine. It's just on a smaller scale.
Yeah.
And so I think that trying to make that connection can be really big. But one thing that kind of struck my mind is the importance of helping our patients go to those specialists and understand that. Doc and Dawn bring a lot of energy to the rest of our conversation. Tune in next week where we talk about some financial advice. Ready to take the next step in your journey? Book an intro call with Ignite DDS Coaching today and level up your future in dentistry.